each hold a very special place in my heart and always will. Let's bend your knees. Okay, so to avoid you having the best shot in the room there. Okay. The breathing compression option here. You guys okay? Oh. Thank you. Breathing progression. Now, if you guys look at these kind of like 4 positions, it's actually 1, 2, and 3, where I'll kind of go through this with you here. Starting in a resting position, then we progress to knees into a tabletop. Can you bring the other one up too? Feet flexed here, usually. And then the next step in the progression is to tap one heel down at a time, coming from the hip, not the knee. So if you can give me, yep, perfect, and then start alternating. Okay, and then some of you in the room should be like, excuse me, we were in the protect phase, right? Is anybody having a minute? Like, you want me to do this with my 4-week postpartum patient? No. Okay, so this is the general breathing progression that we'll typically use, but in this phase, we don't have access to those 2nd and 3rd positions because we're not at the point where creating this level of tension is safe, right? So I'm not recommending that you guys use tabletop position with patients until they're ready for that. That N equals 1. It could be 4 weeks for some, you know, there's people out there running marathons 4 weeks after giving birth, and I'd argue that if you can run a marathon, you should be able to get your legs up into a tabletop position. But that's just not gonna be the norm, right? So you guys gotta pick and play whenever it makes sense for you. So the first step though, and honestly, you can go super like parasympathetic benefit here, almost only, is we put one hand over our chest and one hand over our abdomen, not belly, like above belly button, but like thumb and navel, hands low. And we're gonna work on expanding here. Lots of benefits early on. One here is kind of coming back to that awareness, that proprioceptive awareness of this new abdomen that had a huge shift. We had 40-ish, depending on your timeline, 40-ish weeks to get accustomed to our new position each week. And then all of a sudden, in the period of, 15 minutes to 3 days, that baby came out, right? That was a shout out to the moms who had the really long labors, okay? We had a really quick shift. And so just reconnecting here is huge, right? Now, number 1 focus on our breathing is focusing low. Getting the lower abdomen to expand on our inhales, okay? Not pushing our lower abdomen out, it's letting the breath move the lower abdomen out, okay? Different thing. Obviously the air is not going there, it's pressure, but you get it, you catch my drift. The second stop we get to make, and this might be where you end, like maybe this is all we need at that point, especially early on, that might be great homework for your patient. And postpartum or not, you like watch this focus take away people's low back pain. Like how many people just some breath attention will like turn the dial, right, on something that's, been a 5 out of 10 consistently and chronically, and now they're a 3 or a 2, and they're like, wait, I like this new doc. I think I'm gonna come back and keep letting them help me, and then we get to do the work to build them up to that 0 out of 10, right? It's not gonna take it away completely, but it's a great step. Neck pain, same story. After we go to this kind of like, can you breathe low question, the next question is, can you breathe around? So I like this to be a patient-led thing. Now, my hands can be doing an assessment to help guide like where we should go, but can you put hands around your, we were in California, so if you say soft parts of the body, it was like not cool to say, so I was like, if you had a soft part on your body, I'd like you to put your hands right where that would be, if you did. Plastic joke, okay? So hands on the soft part here, and I want you to feel expansion into your fingertips in the front, to the sides of your hands on the sides, and to your thumbs on the back. Okay, and you guys can do this while you're seated if you want, just kind of like playing around with like, first of all, self-assessment, like where is your breath occurring now? And then secondly, can you create that uniform 360-degree expansion that we should be having on the inhales? Okay, now some of you tried to do that just now. You're like, I'm gonna try to do this. And when you were trying to breathe into your posterior, you started to breathe superior. Did anyone just feel your chest kick in to try to help? Okay, that's one of the things we gotta manage here. We don't need to be adding any more tension up here. We're already stressed, right? Lack of sleep is a real thing. And with the demands of breastfeeding, or feeding in general, so like, but we usually feed babies like this, whether it's from the breast or not. So the upper body challenge of postpartum is actually a shared pain that is across all of the caregivers, right? Holding the bottle like this for a long period of time. And then you take the bottle out and they're sleeping and you don't want to move because they're sleeping and this is the only place they do sleep. And so you're like, I'm not leaving here ever, actually. I don't care if I end up with permanent torticollis. I will be here forever to get this little angel to sleep, right? Even like if you haven't tried to get a baby to sleep, then you don't understand that, but that's a real thing. So it's huge for us to keep the breath low here, all right? Now, as we get closer into that 6 and maybe 6-ish weeks, 5-ish weeks, it's time to start progressing things, but we're not ready. Go ahead, check knees to tabletop for me here. That's a big jump, isn't it? It is a huge shift in load, and we get a lot of sagittal pressure in the abdomen, and a lot of times we're just not ready for that yet. So how do we progress into it is kind of what I wanted to get into. Now, if you guys can just all imagine with me, the way we would have this patient set up is on a couch or a chair. Like dining chairs work great for this, couches work great for this. We'd have them, they gotta like shimmy up to it, and then they kick their legs up, and then they have support here, but I'm gonna stand on the other side. Sorry, Corbin. So now I'm gonna be the support here. But can you all imagine that this would be a chair at home and not necessarily my home? I'd love to spend all the time with you, but we can't do that. So how does this progression look? First step is they just do the same thing, working low, working around, but with their legs in this position. So even unloaded, we're getting proprioceptive information into the hips, into the core, that when my legs are at 90-ish degrees of flexion, I can breathe appropriately. So we're patterning before we're loading. So we're in this position, working on the breath, and then we're gonna start to up the ante on challenge, okay? So how do we up the ante on challenge? Any ideas, anybody? How do we create more tension, but it's not the same as both legs up into tabletop? Let's start with 1, I love it. So what we do is, I just need a 1-inch up and hold right here with this leg. Right there, hold. And the cool thing is that the chair or the couch is right there. So if that's too much, they start to feel themselves kick into the chest dominant strategy, we just offload back. And so maybe we start with marching. So your focus is on breathing low into your abdomen, and I want one leg up and down, other leg up and down. We're just starting to initiate that movement. Create a little challenge here, start to keep expansion, and you can check in with yourself. Can I maintain that low breath? Can I maintain the 360 breath while I create this challenge? Everybody with me? Okay? We then can progress to a 1 leg up and hold at a time, and we can do that for time, under tension, and then we can switch. Cool. And then, we can try both. Over and down, right? And then we just start to play with it. And our job as the practitioner is to check in with how they're able to manage that. So it's in office, we're not sitting here and coaching reps and sets. In office, I'm checking in with where in this progression do you find something here. Another leave it sing quote for you. Our job is to find the hardest thing they can do well, okay? But it has to be hard. If it doesn't challenge you, it doesn't change you. So if we're not challenging the nervous system, then we're not getting any benefit, right? Then we're just like, well, maybe like endorphins, endorphins. And I hear good things about endorphins, Elwood style. He wasn't with me on that one. Okay. Lots of options here, but we need to find the hardest thing that they can do well, and we got to challenge them. Everybody clear? Any questions on the breath assessment or the